Have you ever noticed that something that once felt natural and reassuring in your younger years now feels different, quieter, less responsive, or even a little confusing? Many men tell me they don't feel wrong, but they sense a subtle disconnect, as if their body no longer answers in the same way it used to. That feeling can be unsettling, especially when no one ever warned you that this stage of life might come with such quiet changes. My name is Dr. James, and for decades I've worked closely with men in their 60s, 70s, and beyond, helping them navigate the physical and emotional shifts that come with aging. I've sat across from countless men who carry these questions silently, unsure whether what they're experiencing is normal or whether they've done something wrong along the way. What I can tell you is this: you are far from alone. Many men over 60 continue using habits they formed years ago, not realizing that the body they live in today has different needs, rhythms, and signals. When those changes go unnoticed, even well-intended routines can begin to work against comfort, confidence, and long-term health. In this video, I want to help you understand why these changes happen and how small, thoughtful adjustments can restore a sense of ease, awareness, and connection with your body. And before we go any further, there is one common mistake almost every man overlooks, so subtle that it often goes unnoticed, yet important enough to change how everything feels moving forward. Mistake number 1: believing that holding everything in protects your strength. If you're watching this in your 60s or 70s, there's a good chance you've lived most of your life being told that restraint equals strength. Many men I speak with grew up believing that the less often they release, the more energy, control, or vitality they'll preserve as they age. At this stage of life, when the body feels more fragile and every health decision seems to carry more weight, that belief can feel especially tempting to hold on to. This mindset usually shows up quietly. It's not something men talk about openly. It often appears after retirement, after a health scare, or when sleep becomes lighter and the body doesn't bounce back the way it once did. In those moments, some men decide, consciously or not, to suppress natural release for long stretches of time, thinking they're protecting themselves or avoiding further decline. But from a medical perspective, especially in men over 60, prolonged suppression can work against the body rather than support it. The prostate is an active gland, not a storage unit. When normal release is avoided for extended periods, fluid congestion can develop, increasing pelvic discomfort, pressure sensations, and in some cases aggravating urinary symptoms that many older men already worry about. For someone already anxious about prostate health, nighttime urination, or unexplained pelvic tension, this can quietly amplify fear and confusion. What makes this particularly difficult is that the consequences are rarely immediate or dramatic. There's no sharp pain that tells you to stop. Instead, men may notice subtle changes: heaviness, restlessness, disrupted sleep, or a vague sense that something isn't quite right. These signs are easy to dismiss, especially for a generation taught to push through and not dwell on bodily signals. Understanding when restraint helps and when it harms is crucial. Short periods of abstinence may be appropriate in specific medical situations, but making long-term suppression a habit without guidance is rarely beneficial for aging prostate health. After watching this, the most important step is not to force a change, but to reconsider the assumption itself. Ask whether the habit you're holding onto still serves the body you have now. As we move into the next point, we'll look at another common pattern, one that feels harmless because it's familiar, yet places a different kind of strain on the aging nervous system and pelvic tissues. Mistake number 2: relying on the same technique year after year. After decades of living in the same body, familiarity can feel comforting. For many men in their 60s and beyond, routines become a form of stability, especially as health feels less predictable. That includes deeply personal habits that were formed years ago, often during a time when the body responded quickly and without effort. It's common for men at this stage to assume that if something worked before, it should continue working now. This habit usually isn't questioned unless something begins to feel off. A man may notice reduced sensation, a longer time to respond, or a growing sense of detachment afterward. These changes can be quietly alarming, especially for someone already carrying concerns about aging, prostate health, or loss of function. Many men fear that these sensations are signs of permanent decline, so they stick even more tightly to what feels familiar, hoping consistency will protect them. From a medical standpoint, however, the aging nervous system doesn't respond the same way it did at 30 or 40. Repeating the exact same pattern of stimulation over many years can condition the nerves and surrounding pelvic tissues to respond only within a very narrow range. Over time, this can dull sensitivity, strain localized tissues, and increase frustration. For men who already worry about losing what they have left, this cycle can quietly deepen anxiety and self-doubt. The impact isn't limited to sensation alone. When the body adapts too rigidly to one pattern, it may become harder to relax fully, which can increase pelvic tension and interfere with natural recovery afterward. These effects tend to build slowly, making them easy to overlook until they begin affecting sleep, mood, or confidence. The fear many men carry is not just about physical change, but about losing control over something that once felt reliable. The goal here isn't to abandon what feels safe or force sudden change. It's about recognizing that variety and gentleness are forms of support for the aging body, not threats to it. Small adjustments, made thoughtfully and without pressure, can help re-engage the nervous system and reduce unnecessary strain. As we move into the next point, we'll look at how speed and pacing, often shaped early in life, can further influence comfort, recovery, and long-term well-being after 60. Mistake number 3. Rushing through the experience as the body slows down. For many men now in their 60s and 70s, speed was once a necessity rather than a choice. Earlier in life, hurried habits often developed quietly, driven by privacy concerns, busy schedules, or a mindset that valued efficiency over awareness. Those patterns became automatic, and decades later, they can still be running in the background even though the body itself has changed significantly. At this stage of life, rushing often shows up during moments of fatigue, stress, or emotional distance. A man may feel less patient with his body or subtly worried that things won't respond the way they used to. That worry can create an unspoken pressure to get it over with, especially for someone already carrying concerns about prostate health, nighttime urination, or reduced stamina. What many men don't realize is that this urgency can quietly work against comfort and recovery. From a medical perspective, the aging pelvic region requires more time to warm, relax, and circulate blood effectively. When stimulation is rushed, the nervous system doesn't fully engage, and the muscles of the pelvic floor may tighten instead of releasing. Over time, this pattern can contribute to lingering discomfort, a sense of heaviness afterward, or difficulty fully relaxing later in the evening. For men who already fear worsening urinary symptoms or poor sleep, these effects can heighten anxiety without a clear cause. The most troubling part is how subtle the consequences are. There's rarely an immediate signal that something is wrong. Instead, men may notice they feel emotionally flat afterward, less rested at night, or vaguely unsettled in their bodies. These experiences can feed a quiet fear that aging is taking something away permanently, when in reality, the body may simply be asking for a different pace. Understanding when to slow down and when rushing is no longer appropriate is a key shift after 60. This isn't about extending time for performance or chasing intensity. It's about allowing the nervous system and pelvic tissues to respond naturally without pressure. Simple changes like paying attention to breathing or allowing pauses can support circulation and reduce unnecessary tension. As we continue, it's important to recognize that pacing alone isn't the full picture. Even when men slow down, many still focus narrowly on one area of the body, overlooking how interconnected the entire pelvic system truly is. That oversight leads directly into the next point, which addresses a limitation most men never realize they're carrying. Mistake number 4. Treating the body as a single point instead of a connected system. By the time a man reaches his 60s or 70s, he knows his body no longer works in isolated parts. A stiff back affects sleep, poor sleep affects mood, and stress shows up in places he never expected. Yet many older men still approach intimate self-care as if only one area matters, narrowing all attention to a single point and ignoring the rest of the body that supports it. This habit is rarely intentional. It's simply how things were learned long ago, when the body felt more forgiving and recovery happened automatically. This pattern often appears during periods of physical change or quiet concern. Men who are dealing with lower back tightness, hip stiffness, or mild urinary symptoms may not connect those issues to pelvic tension. Instead, they focus harder on one area, believing concentration will compensate for what feels diminished elsewhere. Underneath that effort is a common, unspoken fear that spreading attention will expose weakness or that noticing other sensations will confirm something is wrong. Medically, this narrow focus can increase strain rather than reduce it. The prostate does not function alone. It is influenced by blood flow, nerve signaling, breathing patterns, and the tone of the pelvic floor muscles. When the rest of the body is tense, tight shoulders, shallow breathing, clenched abdomen, the pelvic region often mirrors that tension. Over time, this can contribute to lingering discomfort, a sense of pressure, or difficulty fully relaxing afterward, which many men quietly worry could signal worsening prostate issues. The challenge is that these effects build gradually. There is no clear moment when a man can say, "This is the cause." Instead, he may notice subtle changes, feeling less settled in his body, more restless at night, or less emotionally connected to the experience. These sensations can deepen anxiety, especially for men already concerned about aging, independence, and maintaining control over their health. The shift here is not about doing more, but about widening awareness. Allowing attention to include breathing, posture, and surrounding muscle groups can reduce unnecessary pelvic tension and support healthier circulation. This broader approach often feels unfamiliar at first, but it aligns far better with how the aging body actually functions. As we move forward, there's another practical factor that strongly affects comfort and tissue health with age, one that many men overlook because they assume it shouldn't be necessary. That oversight leads directly into the next point, where small physical support can make a meaningful difference over time. Mistake number 5. Avoiding simple support the aging body now needs. For many men over 60, there is a quiet pride in continuing to do things the way they always have. Needing assistance can feel like a loss of independence, especially after a lifetime of self-reliance. When it comes to intimate self-care, this mindset often leads men to avoid any form of added support, even as their bodies clearly signal that things no longer feel the same. What's rarely said out loud is that this avoidance is often rooted in fear of admitting change, or of confirming that aging has taken something away. This issue usually becomes noticeable during moments when the body feels less forgiving. Skin becomes drier, joints in the hands feel stiffer, and sensitivity fluctuates from day to day. Many men experience mild irritation or lingering discomfort afterward, but dismiss it as just getting older. For someone already monitoring prostate health, urinary changes, or sleep disruption, these sensations can quietly increase worry, even if they're never directly linked to the cause. From a medical perspective, aging tissues require more protection, not more force. Reduced natural moisture and thinning skin increase friction, which can lead to microscopic irritation and unnecessary strain on the pelvic region. Over time, repeated stress of this kind can contribute to sensitivity loss, prolonged discomfort, and a sense that the body no longer recovers the way it once did. These outcomes often reinforce the fear that decline is inevitable, when in reality, the issue may be lack of adaptation rather than loss of function. The most difficult part is that many men believe support should only be used when something is wrong. In truth, preventive care is most effective before problems escalate. Just as older adults accept reading glasses, supportive footwear, or ergonomic chairs without shame, gentle physical support is simply another way of working with the body instead of against it. Ignoring these needs doesn't preserve strength, it often accelerates discomfort. The action step here is not drastic change, but permission. Permission to recognize that comfort matters, that protecting tissue matters, and that adapting is a sign of wisdom, not weakness. Small adjustments can reduce strain, improve recovery, and support long-term pelvic and prostate health. As we bring everything together, it becomes clear that these mistakes are not about poor judgment, but outdated habits carried into a new stage of life. In the final moments, we'll step back and look at how shifting mindset, away from control and toward care, can restore confidence, ease, and a deeper sense of respect for the body you're living in now. 6. Reclaiming awareness, protecting health, and moving forward with confidence. Reaching your 60s and beyond often brings a quiet realization that the body no longer gives unlimited margin for error. Things that once felt automatic now require attention, and small misunderstandings can have larger consequences over time. This is not a sign of weakness, but a natural shift toward greater fragility and greater wisdom living side by side. The message throughout this discussion has never been about fear, but about awareness, understanding that the aging body speaks more softly and that it deserves to be listened to with care. Many of the risks men worry about at this stage do not arrive suddenly or dramatically. They develop quietly, often at night, when circulation slows, muscles tense unconsciously, and the body does its deepest repair work. Poor habits, unnecessary strain, or chronic tension can show up later as restless sleep, frequent nighttime urination, pelvic discomfort, or a lingering sense that recovery is no longer complete. These are not isolated problems. They are signals that the body is asking for adjustment, not resistance. What makes this stage of life challenging is that outdated beliefs can prevent those adjustments from happening. When men continue treating their bodies as if nothing has changed, they unintentionally increase stress on systems that are already working harder with age. Understanding correctly how the prostate, nerves, circulation, and pelvic muscles interact creates the opportunity to respond wisely instead of reactively. Small changes in approach, pacing, and mindset can reduce strain and support stability where it matters most. Looking ahead 1 to 5 years, the choices you make now quietly shape the quality of your future health. Men who adapt early often experience better sleep, fewer urinary disruptions, more physical comfort, and a greater sense of confidence in their bodies. Those benefits compound over time, protecting independence and peace of mind. On the other hand, ignoring subtle signals today can allow manageable issues to become chronic concerns that feel harder to reverse later. The deeper truth is this: aging does not mean losing control over your health, but it does require a different kind of responsibility. Proactive care, thoughtful adjustment, and self-respect are what protect you moving forward. When you choose to understand your body instead of fighting it, you reduce unnecessary risk and create space for steadiness, comfort, and dignity in the years ahead. This chapter of life is not about doing less. It's about doing things more intentionally. By recognizing the body's vulnerability and responding with informed care, you give yourself the best chance to remain healthy, rested, and confident well into the future.